Good evening, everyone. Wow. Happy Tuesday, or happy whatever day you happen to be watching this recording, this replay. I'm sure it's going to be shared many, many times. I am so excited for this evening. My name is Dr. Stacy Holweger. I have 2 PhDs in integrative and functional medicine, and I am joined this evening by Dr. James Kneller, who is a medical doctor, cardiologist. I'm going to be sharing his bio here in just a minute. But you are in for a treat. We know February is Heart Health Month. We really focus on our heart and how to make it the strongest muscle in our body, of course, for our longevity. And Dr. Kneller has been on here before. I know his replay has reached over 20,000 people from just that Zoom alone. So I'm sure this one will far exceed that. LifeWave has grown so much since the last time you were on here, Dr. Kneller. So before we get started, let me first just share our disclaimer. I am not a medical doctor. Now, even though Dr. Kneller is a medical doctor, he's not your medical doctor for most of you. There might be a few patients on here, a few of his clients, but please understand if you have questions about your health in regards to your medications or what's going on with you, please check with your doctor, your healthcare practitioner. He will be answering questions throughout this presentation. He's going to be screen sharing and sharing lots of information, research, things that are published that he has been working on with LifeWave's technology. But of course, LifeWave is not here to make any claims to treat, cure, diagnose, or prevent anything that's going on with you. So before I get started, Dr. Kneller, MD, PhD, FHRS, is one of the nation's leading heart rhythm specialists. Dr. Kneller is certified by the American Board of Internal Medicine in clinical cardiac electrophysiology, cardiovascular disease, and internal medicine. And as a fellow of a Heart Rhythm Society and certified cardiac device specialist, Dr. Kneller provides comprehensive patient care, combining best medical practice with invasive procedures using state-of-the-art technologies to treat heart rhythm disorders. Dr. Kneller earned his medical degree from UCLA, from McGill University, Montreal, Quebec, Canada first. In addition, he holds a PhD in pharmacology from McGill University, a MSc in bioengineering from the University of Pittsburgh, PA, and a BSc in mechanical engineering, magna cum laude, with a minor in mathematics from Walla Walla University College Place in Washington. And he has completed a cardiovascular fellowship at New York Presbyterian Columbian University Medical Center and clinical cardiac electrophysiology fellowship at the Medical College of Virginia, Richmond, VA, and UCLA Cardiac Arrhythmia Center in UCLA. Wow, Dr. Kneller holds appointments as Associate Clinical Professor, Internal Medicine, University of Arizona College of Medicine, Phoenix, Arizona. He is an Adjunct Clinical Associate Professor, Pacific Northwest, University of Health Sciences, and Clinical Assistant Professor from College of Medicine, Washington State. He has numerous research publications, which you will be seeing some of them this evening. In the area of electrophysiology, he performs peer review for multiple scientific journals and serves on the editorial board of EP Lab Digest. Now, outside of medicine, he enjoys water skiing, snow skiing, the performing arts, international travel, reading, and gardening. And beyond guided directed therapies, he is passionate about optimized personal health. With a deep interest in complementary alternative medicine, he strives to reduce the need for pharmaceuticals, invasive procedures, and exposure to harmful radiation. I will put his bio in the description as well as his contact information. Dr. Kneller, thank you so much for being back on here again. We are so excited to hear from you a little bit more about you, what you do in your practice. Obviously, you're in your office or lab right now, and tell us, of course, all the things, and take us up to how you found out about LifeWave and why you're incorporating this with your patients.
Yeah, well, thank you, Dr. Stacy, so much. It's a thrill to be here with you on your podcast. Really an honor. Love your audience and your commitment and the um, what you're providing for people in terms of LifeWave education. It really is some of the most highest quality content that's available. So I really value that. And it was a pleasure to meet you at the Dallas convention and not to have been here one time before. So thank you very much. And my goal is to make this interesting and relevant to everybody. And after basically, I think with a lot of education, what you learn is to appreciate what's simple and what really works. And that's true in my heart rhythm practice, and certainly what LifeWave technology represents. At the end of the day, we want solutions that work and make a difference for us. So that's always very important, and always my priority with any patient encounter. One thing I like about LifeWave in particular is that patients come to me for cardiac issues, and their cardiac issue can be big or small. But what I don't have is a lot to do with a lot to help with their other issues, which is, of course, often overwhelming and much greater than the cardiac issue. They may have atrial fibrillation, and that's something that we need to address. But their back pain or headaches, migraine headaches, the fact they can't sleep at all, these sorts of things are overwhelming for them and by far their priority. And having a background in internal medicine, we like to help the whole patient and to address what's most relevant for those individuals. And LifeWave fits in so naturally to sort of that paradigm of wanting to help people in the ways that matter and are important to them. And again, the beauty of the technology, I realize this is not an FDA-approved project or a product, it's a wellness product. But the clinical benefits are certainly manifest for so many of us. And the beauty of it, no drugs or chemicals enter your body. So patients have all sorts of allergies, they're on all kinds of medications. You have to think about interactions anytime you change anything. And the patches just bypass all of that very elegantly. And they're all responsive to your own energy, the energy that you emit. So the strength of the effect that comes back into your body is going to be somewhat proportional to the energy you're emitting in the first place. So that's going to kind of naturally modulate the activity that your body is able to tolerate from the patches. So it's really a remarkable area. And in cardiac electrophysiology, there is a very big field of basic science research called cardiogenomics, where basic scientists are trying to place light-sensitive proteins in the heart so that external sources of light can be shown into the body to exert biologic effects. And that's a very fancy version of what LifeWave is already accomplishing. So we know there's already light-sensitive proteins in the body, and that our own energy can be reflected back into us to activate those proteins in a way that's clinically meaningful for each of us. And that's what LifeWave has accomplished without all this very, very fancy science of transfecting cells with genes that will then grow specialized proteins that can respond to light. Then we'll figure out a way to shine the light in to get meaningful things done. I mean, there's a lot of promise there, but knowing that that's a big area in cardiology and basic science research, I love that LifeWave has captured that mechanism and brought it right to the level of the individual and the patient, bypassing those years of research and clinical testing before such technologies are ever going to get approved. So just a wonderful, wonderful result. And I'm an electrical doctor, so I like electrophysiology and spend a lot of my time ablating heart rhythms and doing pacemakers and defibrillators and tinkering with these devices to help people in the best way possible. But our patients have many other cardiac issues. They have blocked arteries, they have heart failure, so the pump function is weak, and we're all involved with helping patients with those problems as well. The coronaries, the heart failure, making the pump stronger, stabilizing heart rhythms in a way that affects whole person heart health to help the heart recover to the greatest extent possible. So my research with LifeWave has been more related to heart failure and how can we tease the heart to have higher levels of function in terms of the main pump function of the heart, which is that left ventricular function, that left ventricular ejection fraction. And that's the holy grail parameter of really heart failure cardiology, is how can we make that pump as effective as possible and get that pump function as high as possible. Normal being 60 to 65% function, egregiously low requiring a defibrillator is less than 35%. So really there's a 25 to 30% range of heart function between perfectly normal and very seriously compromised. So anything that we can do to move the heart within that 20 to 25% range of function is very meaningful. And we give folks medications to take for years. We use these cardiac contractility modulator pacer devices that can help the heart get stronger. And we try to open every artery possible, advise people on optimal heart health and nutrition that can go along with all of our therapies to make the heart stronger. And how wonderful to really have stumbled across the right combination of patches that can accomplish that as well, and do that in a way that we can demonstrate scientifically and that is already gaining acceptance with the scientific community. It's a very exciting future. So I'll present a little bit about what we found. I've talked about it before, show you some of the newest publications and citations that you can use to support your LifeWave business and your sharing of the product and technology. There's something about a peer-reviewed study that has a little bit more bite than some of the testimonials that we often see. Even those are sometimes even more amazing. It's nice to have a well-presented study, and those are all available for you to use in your business. And a great time to do this in Heart Health Month. We know that cardiovascular disease is the #1 killer in Western society today. It is still ahead of cancer. So more people will ultimately succumb to heart disease, heart failure, arrhythmic death than they will from any other cause. So maintaining your heart and tinkering with your heart and monitoring your heart health and optimizing your heart health at every possible opportunity is absolutely one of the best ways to achieve quality of life and longevity. So exciting time to focus on the heart today, and I'll dig into this a little bit more. So the grand title of our research is transcutaneous phototherapy, which is what LifeWave is. Okay, it's phototherapy through the skin, but not leaking into the skin, okay? With the carnosine patches, which is one of David's original patches from LifeWave, improves left ventricular systolic function. And again, that's the squeeze function of the heart. And we'll take a look at how we've been able to demonstrate that. So just to have it in the podcast, my practice coordinates, I'm a regular bedside office EP lab cardiologist in Lake Havasu City, Arizona, at Lakeside Heart and Vascular Center. I'd be delighted to see any one of you in my practice here after an initial visit. And sometimes without it, we can do telehealth visits and keep in touch by phone. And then my wife and I are in the process of founding the Natural Cardiology Institute, looking to provide natural therapies to heart patients to assist with various conditions. And we are poised to launch our natural products for atherosclerosis and coronary artery disease. Can we give people natural alternatives to cholesterol-lowering medications and natural therapies that can help regress atherosclerotic plaque to give patients the best heart health possible, hoping to help individuals achieve freedom from pharmaceuticals? So we're very excited about that. It's going to come out any day or week now, and keep in touch with me by email. That's our website and our new logo and branding. And I'm just very excited to have this being poised to offer to patients across the country and worldwide. So, and we'll also have online tools and resources to help people implement those products themselves, and a concierge model for individuals who want to have specialized consultations through that service. So let's talk about what's happened this past year. 2024 was big for me. So it started with American Heart Association Basic Cardiovascular Sciences. That was in July of 2024 in Chicago. My first abstract with first data set of patients. The title was Phototherapy to Stimulate Carnosine Activity and Enhance Global Heart Function, a promising adjunctive therapy for congestive heart failure. And there is the references at the bottom there in the journal Circulation Research, which has those abstracts. And if you just Google this, this will pop up for you on Google. And feel free to share it with anybody who you're trying to convince or who wants more information about LifeWave. There's a little selfie in front of my physical poster there at the Basic Science Symposium in Chicago. A lot of interest surrounding the product. A lot of people are very curious. This is a basic science conference where scientists around the world are scratching their heads and trying to come up with the next greatest thing to help heart health. And we certainly, attracted a lot of attention and good feedback with this abstract. People found it absolutely fascinating. And then with a larger subset of data on the same theme, back to the American Heart Association in November of 2024 for the clinical conference. And this time that abstract was simply titled Transcutaneous Phototherapy Improves Left Ventricular Systolic Function. And this is the reference again. And if you Google that title, this will pop up and we can share that with anybody. So here is someone took a photo of me by my, this is a moderated poster session electronically where you are in front of an electric board and audience members can gather around you to listen to your abstract at this beautiful session there in Chicago. And I won't belabor it for you, but if you want to read the entire abstract afterwards on the YouTube video, here's that entire abstract that you can read through and feel free to share. But basically, in a nutshell, we use the carnosine patches to improve the squeeze function of the heart in a time frame of only 30 minutes, which is really remarkable. It's a nice opportunity to appreciate, again, the function of carnosine. Carnosine is a little peptide. It's a little 2-amino acid peptide, meaning it's a protein that is throughout our bodies in every cell, all tissue types, but particularly in muscle tissue. And that makes sense because carne stands for meat. That's carnivore, carne. It's the amino acid of meat, but has remarkable properties. It's not just forming muscle fibers. So we know that carnosine has antioxidant properties, anti-glycation properties. It improves the immune system. It gets rid of tumor cells. It rejuvenates and protects aging cells. It has anti-tumor activity. It's a metal chelator to help you detoxify. And very importantly, it's involved in energy metabolism, which is mitochondrial function. So if you can stimulate the activity of carnosine, you can improve the function of mitochondria, which are the little cellular engines that are in each of our cells. So a muscle cell like your heart cell will have about 300 little mitochondria inside per cell. And those are the little units that are generating the ATP, which is the cellular energy currency. So the better they function and the more ATP they produce, the younger and more vital we are. So mitochondrial function is a big deal. And activating carnosine will directly benefit mitochondrial function. And that was the property of carnosine that we were trying to exploit in this study. So this is using cardiac ultrasound to study heart function. So many people have had what we call an echo, a cardiac echo. We're performing all these times in our patients to check the valve function, to check the squeeze function of the heart, the size of the chambers, look for other abnormalities, shunts, for example, in the heart. A very common test for us is the echocardiogram, and that's what we used here to test the carnosine patches. So our experimental protocol looks a little over the top, but this is it here in the corner. So here you see one of our patients with all of these patches plastered across the left side of their chest, from the sternum across the lower chest, right into the left axilla. And all of those are carnosine patches. So we put on like 10 to 15 patches, smother the chest wall, try to max out that effect. And to do that, performing an echocardiogram. Ooh, I'm drawing now. Perform an echocardiogram at baseline. And then after applying the carnosine patches, without that person moving, drinking, having any activity, repeat the echo 30 minutes later and see if we could objectively quantify a change in pump function. So here is a representative example in still shot where we're quantifying an ejection fraction to start here of 70% in the top panel on the left, and then on the right panel, that pump function in the presence of carnosine improving to 78%. So here's a normal healthy individual now with a 8% improvement in ejection fraction. And again, for us, that's an astonishing result because we will give folks medications for years trying to achieve that same result when their heart function is low. So seeing that result in front of your eyes in real time across a 30-minute time interval is really nothing short of astonishing. So then we can measure that pump function in different imaging views and see what we find. Here it is in live. So just watch this. You can see in the baseline images and then in the presence of carnosine. And you can, that's a picture of the left ventricular chamber. So there we go. And you can just appreciate that the squeeze function with carnosine is noticeably stronger. Those walls come together, clearly come together and close that chamber more effectively than they did at baseline. And again, that's one individual laying on an echo table, not moving, not budging, not eating, not drinking, nothing at baseline and 30 minutes after applying the patches to their chest. Then other properties to go along with that are the tissue Dopplers, so we can actually measure the velocity of the muscle as it contracts and as those fibers come together. And you'd think if the chambers, if the ejection fraction is going up, that muscle must be contracting faster at some point. And yes, we can directly measure that with the ultrasound. So here we see, the muscle moving 6.53 centimeters per second at baseline, and then in the presence of carnosine up to 7.3 centimeters centimeters per second of motion. So as part of that contraction, clearly moving faster. And then we can measure the blood flow across the valves, the forward flow of blood through the heart chamber, and in the presence of carnosine, all of those Doppler signals for the actual blood flow being appreciably higher. So really an improvement in global heart function, tissue velocities, overall squeeze function, flow of blood through the heart, all things that we could quantify for the purposes of that research study. And there's all of our averages, but again, an improvement in squeeze function of 6 to 8%. Some people were as high as 10 and 12%. I mean, really astonishing. But across averages, we can say 6 to 8%, and that's over 30 volunteers, age 45 to 85. Healthy enough to walk in off the street. We didn't know what their cardiac function was at baseline. So that's very interesting. I'll come back to that to round it out in a second. But another LifeWave study that has been just published now and it's available online, this is on PubMed, is a study, one of our case reports on wound healing. So here is phototherapy to facilitate wound healing following pacemaker infection. So a promising tool that everyone can take advantage of, and that appeared in the Journal of Innovations of Cardiac Rhythm Management. And there's our abstract. And basically what we could show was that in the presence of X39, a very large wound, which you'd think might take a long time to heal, actually healed 50% faster than was expected. And that in an elderly woman who was quite sedentary, not the picture of great health, and just a remarkable result for her that impressed everyone who observed the change. So we were able to write that up, have it presented, have it accepted to this nicely esteemed journal in our field. And again, this is something that's available to all of you to share with your friends and associates in support of you promoting the product and promoting your business. So if you Google this title, this is what will come up on Google, and it's available to you. And if you want to see that on PubMed, which is our National Library of Medicine, the abstract is available to you there as well. So here we have that title and that abstract available through PubMed. So that's a big deal to some people, and it is a big deal, and it adds a certain level of credibility to have that peer review and to be in that database. And it's certainly there and available for you. And again, using the X39, this time in isolation as monotherapy to achieve wound healing that was clearly twice as fast as anyone would have expected. In someone else, it might have been even faster than that. But in this particular example, that's what we could measure. So these are the three figures from that paper, where here you see a nasty pacemaker infection brewing and getting worse until the device has to be removed. And then we have this gaping wound that's partially infected. And so we wanted to leave that open and to close by secondary intent, meaning you don't sew it shut, you wait for it to close naturally, which involves having an intensive program of a home wound care nurse, packing that with antibiotic laced dressings, putting gauze over top of it, and to do that every other day until that wound had in fact healed. And here you see we were able to add the X39 patch that we would place right next to the wound and change that out on a daily basis. So here we see going from an open wound to very quickly getting smaller to finally becoming completely closed with a scab and then very nice scar resolution. And this, the wound closure happening by 6 weeks and good scar formation at 10 weeks. And it just got better and better. And compared to the expectations in the database from the wound center, that was a 50% faster healing time. So you say, well, why would anybody who has a wound not use X39 to hasten that healing process? Here's another example that we're still hoping to find a home for in the literature. But here is a pacemaker pocket hematoma. So you can see here at the top of the surgical scar still with its bandages on it, and lots of bruising from a blood collection that formed underneath those steri strips. And this time we used the combination of X39 with also carnosine and glutathione placed around the wound on a daily basis, rotated around. And on the order of 6 days, we went from this fairly messy scenario to this beautifully closed wound. It's shrunk, it's resolved, the scar's formed, it's tight, it's done. 6 days. And if you took a social media consensus across experts in my field who see these things regularly, the average estimated time for that change was 5 weeks. People would have expected that difference in 5 weeks. And with the phototherapy patches in combination this time, we could report a 500% faster healing time. So I'm trying to find a home for that right now in the medical literature. I think some people aren't ready to quite admit that that's possible, but we'll make that available soon. And then one more, I showed this one last time. Pain, muscle dysfunction, and weakness resulting from a radial nerve injury in the setting of heart catheterization. The catheter bangs the nerve and the person doesn't have taste sensation, can't pinch, can't hold a pen, for example, and then also has pain. And with IceWave, solving all of those problems in 30 seconds in a way that we could measure with neurologic testing and with a gripometer to show that their hand grip now was equal to the grip in the unaffected arm. So just some nice demonstrations, some case reports that are available for you to share. Feel free to Google these, pass them around, presenting the product, I think, very nicely and giving some good examples of success and what we should be able to expect from really any individual. It's definitely worth trying if you have any of those issues.
Mhm.
And again, just to explore the properties of the patches, again, this is a little bit of some preliminary data that I have collected where you can do biofield photo imaging, and there's cameras available to take pictures of our aura. This is the energy that our bodies are constantly expressing, which represents a sum total of all of the little quantum chemical reactions and cellular activity that's occurring throughout our organs and throughout our body. We are emitting quantum energy at all times, and that has been well characterized in the medical literature. There's nothing surprising about it. And as David has explained to us so many times, it's our own energy that our bodies are emitting that activate the patches to reflect back into us certain frequencies of light, depending on the patch, that have different biological activities. So we emit the energy, the patch reflects back certain frequencies, and that should interact with our physiology in predictable ways. And this picture is just to say, you know what, if your own energy is being reflected back into you in a meaningful amount, well, that should then change your expression of energy. And your aura field should shift in response to you wearing the patches. So we've done a good amount of preliminary data kind of pursuing that hypothesis. And yes, indeed, you can see changes in your energy aura immediately after applying the patches to your body. So here is a volunteer again, a very red baseline aura energy expression. And that's just the color of that person's emission. That kind of corresponds to a lower chakra type energy. And then applying the Alavita patch to the forehead, which we know really prioritizes frontal lobe activation. So now you would think the dominant expression of your energy would move towards something that's more cerebral and representing higher chakras, if you will, which are usually purple or blue. But here, within 20, 30 minutes of applying the Alavita patch and repeating the photograph, we see that that energy has indeed shifted upwards to a green focus, moving towards those higher chakras. Not getting there because we're starting from red, but really still a very meaningful shift, validating for myself and for anyone that the patches they're really meaningfully interacting with your energy field and inducing changes, which should be no surprise that we're seeing the biologic effects that we do. Because the energy shift in our own expression of energy can really be very dramatic in terms of the patches. I explored several combinations of these, energy enhancer X39, different combos, Aeon, which one. The ones that gave the most dramatic color shift, I think, was Eon on the forehead. So that would really move you the most and change the picture. The other patch combinations might just intensify your aura, even if the color change wasn't much, So to really show a shift in the color, the one we ended up focusing on was the Eon on the forehead. But all of them are going to impact your energy field. Maybe not do the color shift, but could intensify your aura even at the color that you present with at baseline. So that was kind of my presentation. I know it's a little bit redundant from what we talked about before, but I hope we can just appreciate some of these principles again. And I wanted to show those updated references that have become available and make them available to you to share with your business and to grow your business and to convince your associates that the patches are worthy of their investment. It's only going to get more exciting. One idea can make your career. And for me, this improvement in ejection fraction is big enough you could build a career exploring that theme. Now with the energized electrolytes that David's making available to us, will that effect be even more dramatic? Or what if you drink the water? And what if you drink the water and use carnosine patches as well? Are we going to see even greater benefits in terms of LV function? I'm sure of it, and I can't wait to quantify. So my next step right now is to get this out now into manuscript format as a baseline study, and then we'll add those different layers of intervention as those products and nutrient supplements become available to us. It's just a very exciting time for cardiology and to, you know, kind of have stumbled upon or found a meaningful system that will impact the LV ejection fraction, which is just going to get every cardiologist in the room to sit up and pay attention. So it's been exciting, and with the new products that are coming out, it's going to be even more exciting.
Wow.
So there's a summary slide that kind of just summarizes some of the things we've talked about. My email, feel free to reach out to me anytime if I can help. If you want to be seen in Havasu or through telemedicine, we can set that up. And you have my website there for some of the exciting projects that my wife and I are putting together for cardiology patients around the country. Yeah, happy Heart Health Month. Let's be heart healthy. Exercise, lift some weights, move your body, wear the patches, good nutrition.
Mm-hmm. Wow, Dr. Kneller. I know everyone is like, where are the links? Where are the links? We need the links. So are the links to these studies on your website, or are we just Googling? Because I'll go Google them to grab all of them to put in the section here, the description section.
At this moment, I would rely on Dr. Google.
You got it.
Yeah.
I can definitely go to Dr. Google, so don't worry about that. We'll do that after the fact.
Okay.
I know they have a lot of questions here in the chat, so I definitely want to make sure we have our next about 20 minutes, if that's okay with you, to
Absolutely.
and the only way that I know to get those lines off there is to stop screen share and start screen share again.
Okay.
I tried to erase them and it wouldn't let me erase them.
Yeah, how did I do that?
I don't know.
All next thing you know, you're drawing and you're like, oh no.
Well, I wasn't the one that shared the screen, so I think that's why it wouldn't let me erase. There we go. Perfect. All right.
Okay.
So are you open to entertain a few questions?
Of course.
Okay. Now remember, everyone, Dr. Kneller is not currently your medical doctor. So the questions you're asking are obviously in reference to the heart. So he's going to answer those in reference to his background and knowledge and information as the cardiologist. So what if you have ARCA?
ARCA.
Do you know what
What is
that is?
ARCA?
I have no idea.
Arrhythmogenic, right? ARVD? ARCA?
I don't know. Gail asked about that. So, Gail, maybe you could elaborate and we could come back to you. So, in your experience, have you seen that carnosine has helped with AFib at all?
I can't say specifically. Not enough experience.
Okay. What
My
about,
guess is it's going to be electrically stabilizing, but I can't speak to that
okay.
specifically.
What about leaky valve? Have you seen any benefits in that with any of your patients?
I have lots of people with leaky valves who are wearing the patches, and some of them have reported to me that their echocardiogram has shown improvement in the valve function.
Okay. Perfect. So, what about placement? Are you still just peppered all over the heart wall, the chest wall there? Is that good for you still?
I think, that was for the purposes of the research to show that we could have an impact over a short period of time.
Mm-hmm.
I think, in point of fact, wearing one or two a day is about what I would do.
Okay,
You
perfect.
know, if you want to do it on the long run and on a daily basis, I think that's good.
Good. Okay.
Yeah.
What about SVT?
SVT, supporting the heart muscle is going to help to stabilize heart rhythms.
Okay.
That's going to be true for PVCs, for PACs, for SVTs, for AFib. It's a question of, in any one person, is that intervention going to be good enough to have a meaningful change in the rhythm? And for any individual, it's like, try and see, time will tell.
Mm-hmm.
So I believe it's all going to be helpful. Can I say it's going to absolutely change your rhythm for you? I think that's a stretch.
Okay, perfect.
There's so much we can do for rhythms.
Mm-hmm.
Electrolyte replacement. I think the electrolyte product that David's coming out with is going to be a very helpful adjunct. Magnesium and potassium being the most important of those. If you can get your levels topped up, a lot of times your rhythms will stabilize. And then there's a lot of natural products, herbals and botanicals that can stabilize heart rhythms without you having to reach for pharmaceuticals. So there are some natural therapies that we can use before we have to rely on the drugs or on these ablation procedures.
And will you be sharing more information on that with you and your wife on your website? Is that what's coming a
Yes.
little bit? Okay.
Yeah.
Perfect. Okay, fantastic. So we'll keep our eyes open on your website for that. How someone wants to know, how do you approach people that have had a heart attack or are in, having care with their cardiologist?
Yeah. So someone who's had a heart attack, you know, um, my first question is, are you okay now? How much damage was done? That's a measure of the troponins in the blood, but really the echocardiogram, did that show compromise in the pump function of the heart, or did one wall of the heart or one segment of the heart suffer obvious damage? And then right away, are there blood vessels that need to be opened up to reperfuse that heart? So somebody who's really had a heart attack deserves a cardiac catheterization to see if there's an acutely occluded artery that needs to be opened. So moving through that process of getting an echo, having a heart cath, seeing the EKG, we can assess, what exactly happened in terms of the heart attack, how much damage was done, and where to go from there.
Perfect. Thank you.
Yeah.
What about with that carnosine? Do you have any results with just one patch over time, or was it just the 12 to 15 patches in a short period of time?
That's the data that we collected, that, and so the result that we could prove and publish was with the multiple patches. I would love to do the one patch over a longer period of time as a study, but haven't had the chance to do that.
Okay, perfect.
Yeah.
What about tachycardia?
Which was it?
Tachycardia?
Tachycardia, so fast heart rate.
Hmm.
Um, you know, Fast tachycardia means fast heart rate. My first thought is, are you in a normal rhythm, like a sinus rhythm, but it's just a sinus tachycardia? Or has your heart rhythm flipped to something that is not normal, like an SVT or a VT or an AFib, where now the heart's going fast, but because of an abnormal heart rhythm mechanism, and that would tell us how to approach that. But the standard thing to stabilize heart rhythm is start with beta blockers, move on to antiarrhythmic drugs like flecainide or sotalol or dofetilide, depending on the person's underlying heart substrate. And depending on someone's willingness to do that or their success with that, move on to an ablation procedure.
Wow,
Yeah.
that's a lot.
Yeah, we move through that stuff fast and on a daily basis. But so depending on the severity and exactly what is going on underlying the tachycardia, we can offer that whole range of evaluation and therapy, And then some people are like, I'll do, no procedure as long as there's medicines. And other people are like, why would I ever take a med when there's a procedure? So you get people with very different predispositions to the kind of care that they want. And we try to, help everybody with what's important to them, with what's important to them and what they prioritize. But always in the background, heart healthy, cardiovascular exercise, strength training, a great diet. Mediterranean diet is a great guide. The paleo diet is a great guide. Blue zone principles are a great guide. Be as heart healthy as possible. If you have normal renal function, keep your electrolytes topped up. I love the supplements, whether it's glutathione, CoQ10, acetyl L-carnitine, things like this. I'm a big fan and experiment with all of those things. And I think they'll all help to stabilize heart muscle function and help to stabilize rhythms naturally. And then we'll draw on pharmaceuticals and procedures as we need to get people the endpoint that they need.
Yeah, I like that third option you just gave there. All the preventative things.
All the preventative things, I mean, David talks about it. The patches are great, but you need to be looking after your health on the side and hydrating and improving your diet and, you know, and
Yes.
and to empower the patches to really give you as much help as possible.
Absolutely.
We can start with those things right away, but let's do the background work in the meantime.
I love that. All right. So what about myocarditis? That's been a buzzword the last few years.
Yeah, myocarditis. So that's an inflammation of the heart muscle. That's a thing. Can be There's fulminant myocarditis, which is obviously a clinical emergency.
Mm-hmm.
But then for a lot of folks, there's smoldering myocarditis where the heart inflammation is lingering, kind of like hot coals in a campfire that is on its way out, but still too hot to touch. And we've seen a lot of that in recent years. You
Mm-hmm.
know, with the COVID vaccine causing that, and also so the vaccines causing it, and also the infection. Either way, we've seen a lot of people with pericarditis, myocarditis symptoms. So in cardiology clinic, we're seeing a lot more rhythm abnormalities, AFib, SVT, PVCs. They're all showing up, and people can say, oh, that definitely started either with an infection, recently or up to several years ago, or with an infection or a booster that happened recently or several years ago. And they can trace that change to those things. So it's real and it's an issue, and we're all doing our best for our patients, and all the more priority to be as heart healthy as possible, to maximize all those anti-inflammatory foods that we have. I think using the patches is just smart,
Mm-hmm.
to minimize inflammation. We have AON and glutathione, and use X39 to renew your stem cells and renew tissue and minimize fibrosis in your body and in your heart that's resulting from all of these things. In my mind, these therapies are more important than they've ever been in the setting of myocarditis, pericarditis. When people come in and they have that chest pain or an acute change, I'll usually prescribe colchicine, which is an immunosuppressive medicine that we use anyway for most myocarditis, pericarditis before all of this COVID stuff came along. So I'll give patients a trial of that. And usually we do at least 3 months of therapy. And if it really helped them, we can extend that to 6 months as a way of really smacking down inflammation surrounding the heart while we try to reverse those underlying causes.
That's amazing.
Yeah, it's a big topic, and we see it a lot. And the young kids, they all have POTS. My clinic's full of 20 somethings, and they're all fainting or lightheaded, or they stand up and their heart's racing, and now they're feeling dizzy and passing out, and lots of that. It kind of concentrates in a cardiology clinic or a heart rhythm clinic.
Mm-hmm.
But we've seen a real uptick in that younger cohort. So it affects different populations in different ways, and we're trying to figure out what's best for each of those patient groups, and taking these things on an individual basis.
So
And I
do you,
love webinars like this where we can talk about the patches and other wellness products that can be beneficial in those settings without saying that these things treat.
Mhm.
But supportive care is going to be really important for people. And I've seen people with vaccine injury, COVID injury, discover the patches and use the patches and stick with the patches because it's helping them in those contexts.
That's great to hear. And do
Yeah.
you think with our younger population, is that from getting COVID or is that from actually the vaccine that was given to them as well too with the POTS?
I'll say both can do it. Both can do it. Definitely the infection itself, and for some people it was obvious, clearly timed with the vaccine. And honestly, we talk about this at Heart Rhythm. There's lectures by the highest scientific figures in the field, saying how those spike proteins and mRNA vaccines will climb along the autonomic nervous system, damaging the autonomic nervous system as they go. So they'll track along the vagus nerve and, disrupt the nerve function of the autonomic system, which is why we get the POTS, the tachycardias and the hypotension and excessive sweating and all these things that suggest that the autonomic nervous system has been perturbed. So that's the highest quality research in electrophysiology, and there's sessions on that at Heart Rhythm Society meetings, for example. So we don't have to tiptoe around it or be embarrassed to talk about it. It's a thing, you
Mhm.
know. And I think in the younger folks who are more autonomically sensitive because their systems are so robust and healthy, it's really a kick in the pants for them and throws them for a loop. And how it's all going to shake out is yet to be seen. But so much room there for health and wellness products, that benefit our health and help us modulate inflammation and support our hearts and our tissues, naturally and using light-based mechanisms. I'm really excited for the water product. Wow. And the electrolyte product. I think all of that's going to be helpful and people are going to find it useful.
Yeah, I agree. Totally.
Mm-hmm.
Okay, do you work in your practice with people with blood pressure types of issues?
Yeah. Yeah. We do blood pressure all the time. Mm-hmm.
Okay. And I know from our clinical studies in the past, X39, X49 have actually reduced systolic and diastolic over a 60-day period pretty significantly. Have you
Mm-hmm.
used those two in combination in your practice?
In my official practice, where we're billing insurance or Medicare, I definitely say there's good, guideline. I say in the practice we're practicing guideline directed medicine, so I don't bring these complementary things into that setting, but people will come to me with those and I'll say you might want to explore different wellness options in different spaces that can be helpful.
Perfect.
So it's hard to say we're going to use these things to treat your blood pressure,
Right.
but I can refer to integrative practitioners and wellness practitioners and naturopaths who
Mhm.
I know are going to introduce these things as adjunctive things for people's well-being.
Fantastic.
So I'm happy to do that. Then in my thing, I say, well, on top of this, do we have to do from the medical model, the pharmaceutical model to get you to goal?
Right.
Knowing that hopefully with time, as natural health improves, that we can wean back on these things and get rid of them as we,
Mm-hmm. Right.
reverse this,
Yeah, we've
which I
definitely.
think is always what we want to do. We want to get people off their dependence on medical therapies. They're really something to temporize while you have that opportunity to go on work on your health. The reality in a big practice is that different people are going to have different levels of motivation. So some people won't kind of do anything to get off of their pharmaceutical or traditional therapies, while other people are very motivated with exercise and diet and wellness, and they do make progress. So
Yeah,
I
agree.
love that about this crowd, that people are so passionate and so invested in their health and looking for solutions. So the
Mhm.
conversation just completely changes with people who are motivated and seeking.
Yeah, that's I would absolutely say our audience is searching for anything and everything to either reduce the amount of prescriptions and procedures or be able to, come off of them completely. I would say that's our population as a large part. Yeah.
Exactly. Yeah.
So what about a little bit more, they're asking some questions about damage to the heart, as in muscle damage, a hole in the heart, enlarged heart. What is your experience with those types of things?
Yeah, so that's important. There's you can broadly classify a cardiomyopathy or muscle dysfunction as being either ischemic, meaning it's secondary to blocked arteries, or it's non-ischemic, meaning the arteries are completely open and it's really a problem of the muscle itself. So you can imagine if somebody has a lot of blockages and perhaps one of those blockages completely closed, and now that's a heart attack and heart muscle has actually died. So now it's turned into scar. That's an ischemic cardiomyopathy. So that's one type. It'll respond to therapy in different ways. And then other people, even historically, they had the influenza virus, a flu or just a common cold, and the heart function can go from normal down to 20%, and they come in and the heart's big and baggy and dilated and over time with, medical therapy, and it's going to recover function, hopefully to different degrees. But then sometimes it doesn't. And in that case, it's not a problem with the arteries. Heart attack, the topic of heart attacks isn't even relevant. It's really a muscle problem, and we want that heart to reverse remodel as much as possible. And of course, there's going to be a whole gradation of degrees in between that. Um, so the big dilated baggy hearts, that's kind of a non-ischemic scenario. And then in the setting of blocked arteries where different segments of the heart muscle have died, that's different. And they're both going to have different pathways to recover. I think for all of them, activating your stem cells, supporting your muscle proteins is only going to be helpful. And hopefully, just like we know X39 will resolve scars on the outside of your body, it should resolve scars on the inside of your body. So I would expect regions of fibrosis in the heart or heart muscle that appears like it's died and it's formed scar can recover as the stem cells work to restore the muscle. So having a technology that's going to rev up stem cell activity, is only going to be helpful in the setting of the ischemic cardiomyopathies. And hopefully it's enough to turn around the non-ischemic cardiomyopathies. It's like all of our therapies, it's like time will tell. People come in and we put them on, a combination of medications to help the heart get stronger. And we're like, this is the best we got, but for any one individual, it's like, well, time will tell if it's going to work for you, and a lot of times it does, but some other times it's disappointing. And I think in reality, will have to say the same thing with, we have to say the same thing with LifeWave. Hopefully it gets you there. It's going to certainly help a lot of people. Is there any guarantee? There's not a guarantee, but it's the best you can do, and certainly worth trying is how I have to look at it, because that's how we look at everything.
Yeah.
A lot of people improve and get better, and then some, it's just like we're left scratching our heads. Would I do it? I would absolutely do it. Would I use it for rheumatoid arthritis? Yeah, I'd use it for any inflammatory condition. To say it's going to reverse it is hard to promise, but is it going to help? Yeah, it's going to help.
Yeah. Perfect. So
just reading some of the late questions.
Dr. Bradley Ware had asked in the comments, did you quantify the improvement in systolic dysfunction? Did you do tests on people with mild ejection function reduction?
We used a group of volunteers with a wide age spectrum, and they were people who volunteered for the study. And we didn't have anyone whose baseline ejection fraction was really below the range of normal. So, Heart Rhythm quickly wanted to know, hey, what about patients with known cardiomyopathy? And we didn't study that, and I didn't have good examples of that. In terms of diastolic dysfunction, diastolic dysfunction is determined by the tissue velocity parameters. So when we saw improvements in tissue Doppler function, that's going to translate into improvements in diastology. So we saw trends towards improvement in diastolic function. But those were not as dramatic as the changes in systolic function. So yeah, that's a great question. Importantly, heart rate didn't change at all. So that really told us that the carnosine patches weren't changing your autonomic function. Like if you put them on and your heart rate went from 60 to 80, you would say, well, there's probably some adrenaline release that this is doing, and maybe that's responsible for the change in ejection fraction. When we put the patches on, that person laying perfectly still, the resting heart rate didn't budge. The muscle just got more vigorous, which really suggested that it was a local muscle function that was responsible for the change rather than something mediated through a change in autonomic tone. So I know
Perfect.
that wasn't quite the question. So diastology, we saw a trend towards improvement with the improvement in the tissue velocities, but the systolic function was much more dramatic.
Okay. Someone else shared that the fellow cardiologist dismissed the patches as placebo. Can you share your response if another doctor feels like this is a placebo effect? How would you respond to that?
We used a case control study where everybody served as their own control. So the best trial is truly a placebo-controlled randomized control trial where everyone gets a patch. Some of those patches are placebo patches and some of them are real patches. That's the highest quality of evidence. Those trials are difficult to conduct, but that's the highest level of evidence. Case control, which we did, is a good level of evidence where everyone serves, where your control group is your treatment group. So you get the baseline and the change in any one individual. And you can say there's more chance of a result like that to be contaminated by some placebo effect. I'm confident that all of this is not explained by placebo effect. In fact, after having done these studies and watched all of these individuals, 30 individuals come in for their echocardiogram, and seeing their boredom with the whole thing and not being that engaged, but watching their heart function change, I don't think it was really based on anticipation or placebo per se. Folks didn't have their expectations up or down. They were just kind of volunteering and seeing what happened, and a lot of them were actually very dismissive of the whole thing, and were surprised to find that heart function had changed meaningfully. So the level of evidence is pretty good to exclude a placebo effect. We had statistical significance, which argues against the placebo effect. Some placebo could already be there, could have sort of tarnished the result, but I'm confident that this is not purely placebo. There's definitely a direct physiologic action that is meaningful and very real. And then try it for yourself. I mean, I noticed carnosine. I did very standardized hikes, up and down the same mountain several times a week, and got introduced to the patches, put on a carnosine, and felt like I was just flying up this mountain. I mean, it was really a difference. I'm like, wow, something has definitely changed here. And there was, you start to get those personal experience, and you're like, this is very real. It's not a placebo thing. And I really had no anticipation that the patches would do that for me. And I was astonished to find that was happening. So to me, that argues strongly against placebo. So then to take the next step and to put them on a muscle that is involuntary. So, you go hiking up the mountain. Well, you can work at that as hard as you want. The heart, you have no control over what your heart's doing. It's acting on its own. So being able to show that the patches could change that intrinsically activating muscle was, for me, pretty convincing. And I'm not concerned about significant placebo contamination. But
Well,
it's the obvious question, and you
yeah,
have to
of
think of it.
course. And if you go to our research, LifeWave's clinical studies, we have many double-blind, placebo-controlled,
Yes.
peer-reviewed studies that have already been done. And you can, of
Mm-hmm.
course, share those with anyone that is concerned that it might be a placebo. Or you can always share the videos that we have out there about horses don't lie, and our
Yeah.
pets, and those
Mm-hmm.
types of things, because you can't control an animal and what happens to them either. There's definitely not a placebo with animals.
Right.
Mhm.
Right.
Yeah, but I love your answer on try for yourself. Just see for yourself and then see what happens with your own experience. I love that.
Yeah.
So, yeah, Dr. Kneller, thank you so much for this incredible explanation. All the information that you shared here is just,
Absolutely.
I know our audiences, we had about 650 people on here, and they were just absolutely so grateful for you to take the time out of your busy schedule and practice and everything that you have to pour into us and share such vast knowledge of information about the heart, which is, I would say, probably the most important, right? When it doesn't beat, you no longer are here.
That's
So
right.
we want to make sure we're doing everything we need to keep that beating. So thank you again for taking the time. Any last words you'd like to share with everyone?
I enjoyed it very much. Thank you, Dr. Stacy. It's an honor to be on your podcast. I'm looking forward to more results. I'll keep you posted as new developments occur.
Yes,
And yeah, would love to respond to anyone else who wants to shoot me an email and take it from there. Maybe we'll see you in Lake Havasu. We're always here for everybody.
perfect. Thank you for the offer. Thank you for sharing all of your information. And I will definitely get those links into the description section as well too. I'll take a little bit of time and Google all those and find them. Dr. Google will prevail for sure.
Oh,
So
you're awesome. You're awesome. Thanks. Thank you for that.
thank you guys so much. Thank you, Dr. Kneller. Have a fantastic evening.
You too. Bye bye, everyone.